As is often the case in urban metro areas such as Macon, a significant percentage of the population falls below the poverty line and lacks health insurance. This means that basic medical care is not accessible to many of those who need it most, or wouldn't be if it wasn't for the selfless, dedicated volunteers of the Macon Volunteer Clinic.
So had this place had not been here, I would have died in 2010.
A free primary care clinic in Macon was the brainchild of Dr. Chapin Henley, a retired gynecologist.
Well, Chapin, the good photo that you have of him up there, he's a fellow Rotarian, and at the Macon Downtown Rotary Club, he's a member. And about 22 years ago, he was talking about it. And listening to him talk, I realized what he was doing. He was fulfilling the Rotary Creed, which is service above self. And hearing him talk about the need here in Macon and Middle Georgia, and then the research that he did to back that need up, I knew that this place would be successful. And I also knew that I wanted to be a part of the success here that he had.
He read of such a clinic on Hilton Head Island, which was staffed by volunteers and served the poor. He drove to Hilton Head to see the clinic himself and to meet its founder. And when he returned, there was no stopping him. Dr. Henley assembled a group of 25 individuals representing local hospitals, nonprofit agencies, Mercer's School of Medicine, and many others at a local church. He pitched his vision. He described the dire need, and the group concurred. They identified a clear, common desire to offer free, basic, convenient health care to those who cannot afford it.
I'm a family doctor, and I volunteer here once a week, and I've been a part of the volunteer clinic since it opened. I was part of the group that sort of planned the clinic with Dr. Chapin Henley, and he approached me at church, and we started talking to our friends and in church and in the medical community and in civic clubs, and then we formed a little ad hoc committee that met at the local health department. From there, we found a lawyer who helped us incorporate as a nonprofit organization.
They pressed forward, and the support fell into place. More than 200 retired and practicing physicians, nurses, dentists, and others signed up to volunteer. Area colleges offered the services of their healthcare students. Coliseum Medical Centers, now Piedmont, offered vacant medical offices on the corner of Rogers and Ingleside Avenues for $1 a year. Philanthropic grants were awarded, and on February 13, 2003, Macon Volunteer Clinic opened its doors. Its mission? To foster primary health care for all working adults in Macon-Bibb County, regardless of insurance or ability to pay. 20 years later, Macon Volunteer Clinic continues to be powered by philanthropy and volunteer physicians, dentists, nurses, and others.
I first heard about the clinic about 20 years ago from a friend of mine, Alan Rumpf, who was a healthcare attorney. He had faced some serious health issues of his own and was really concerned with sort of the overall state of healthcare for the whole person, not just medical, but also spiritual and mental. And he heard about a group that was putting together a clinic to serve people who didn't have access to healthcare any other way. He was really excited, and I think he had volunteered to do their legal work for them. And just in my conversations with him, I became really intrigued with the idea, and I sort of stayed peripherally connected to it as I heard it coming into being. There came a time when I had something to offer, I thought. Although you can volunteer doing absolutely anything, I had a degree in marriage and family therapy, and I volunteered my services down here to do psychotherapy with the patients.
So I am a longtime volunteer dentist, and I'm also chairman of the board. So I first learned about it back in 2008 when I was getting my master's degree in public health. My father, who is a physician here in town, told me about the clinic. He's an old friend of Dr. Henley as well. And I contacted Dr. Valerie Biskey, who was head nurse here at the time, and she invited me to come here and do my master's thesis project. So I developed a smoking cessation program for the clinic to help them address the obvious smoking cessation needs here. And the second I stepped foot here, I knew this is where I wanted to be long term, to give my time and efforts to the volunteer clinic to help them expand and reach more people.
Well, I first learned about the volunteer clinic when they first opened. There were articles about it in the newspaper. At that time I was working, and I didn't have a lot of time to volunteer then. But once I retired, well, I was looking for something to do volunteer-wise, but it really piqued my interest when I heard about the clinic. I contacted Valerie Biskey at the time, who was managing the clinic. She told me about it, and I started volunteering then.
We had a meeting in the church, one of the churches out on Forsyth Road, to tell about this to anybody who was interested. And a large number of nurses and doctors and interested people, there must have been 50 or 75 people came. At any rate, they were the initial group that we used to get the whole thing going.
Services are at no cost to those who qualify. To be eligible for the services of Macon Volunteer Clinic, the patient must be between the ages of 18 and 64, must be uninsured, must live in Bibb or Twiggs County, must be working, and must earn 200% or less of the federal poverty level. Macon Volunteer Clinic's patients are hard-working neighbors who would otherwise fall through the cracks of our healthcare system. Some don't work enough hours to qualify for employer benefits. Many are self-employed or contract workers in the service industry. They might be fast food workers, children's daycare workers, janitors, housekeepers, groundskeepers, barbers, or artists.
Volunteering here was really a wonderful growth experience for me. And what I saw was people who were much more like me than I realized. And by that I mean actually my socioeconomic level, my education level. These are people who, for some reason, didn't have health insurance, such as being suddenly widowed or going through a divorce, where their spouse had the health care in the family, and they found themselves suddenly in a dire predicament. It made me realize how close I was to being in such a position, that any little thing in my life might make me in need of these services, and how much in that position I would be frightened. I would be wondering about how I would get by, how I would handle it, how the children who depended on me would handle it if I had a health issue.
Without the services of Macon Volunteer Clinic, many neighbors would not have access to the same standard of medical care and preventive services enjoyed by those of us who are insured, and they would likely experience a delay in disease diagnosis. Delayed diagnosis and preventive care leads to negative health outcomes and high health care costs, not to mention the financial stressors associated with these, which contribute to increased depression and anxiety.
Well, they send me to the best doctors. Anytime I've had to have any kind of test done, colonoscopy or anything like that, I get a little discount on my medications, and they just really show that they care about you. Dr. Roche is an absolute god when it comes to doctors. Coming to the clinic has been a great experience. It's not like what I had been afraid of. I don't sit for a long time. There's not a lot of waiting in line. Make an appointment, you keep your appointment, and they get right to you.
At the time, we didn't have insurance, so I ended up being actually a patient here. And they did some service for me. But the most important thing back in 2010, the head nurse Valerie was here. I came by just to get my knee checked out because I had some issues with my knee. And she asked me, well, was there anything? And I told her I have a little pain in my chest, but I'm used to that. So she said, well, let's do an EKG on you and all of that. She found out that I had a heart attack and didn't even know it. And they immediately rushed me to the Coliseum Hospital. And sure enough, they were waiting for me. I go in, Dr. Joe Johnson, Dr. Zoe Jones, they come in. They thought they were gonna just put a stent in, but they found out that I had 6 blockages, 4 100% blockage, and 2 65% blockage. They didn't know how, I should have been dead. But because of the Macon Volunteer Clinic and them going that extra step, just because I said I got a little chest pain, checking it out, I was in the hospital and I was there. They took the arteries out of my leg, put it in my heart, it was fine. But 10 days later, I got even weaker and I had to go back in because they found out 3 deadly diseases had set in. So had this place had not been here, literally, you and I would not have these conversations right now. I would have died in 2010. But because of that little extra, that one little question that Valerie asked, is there anything else? But because this facility being here, it saved my life. I'm grateful. My family is grateful. And then when I turned 65, I was able to get my whatever Medicaid and all that you get. But I kept coming back as a volunteer.
Our patients are people with basic needs but limited options. They arrive to us with huge relief and appreciation for the care they discover here, all made possible through gifts of time, talent, and treasure. They no longer must choose between feeding and clothing their children and purchasing medicine to control their diabetes or to be screened for cancer. We invite you to invest in our important work and to learn how you can partner with us on this remarkable community mission of providing primary health care to uninsured, working, financially challenged adults of Bibb and Twiggs counties.
As a volunteer dentist and someone who helped start the restorative dentistry practice here at the volunteer clinic, the biggest challenge with that has been to obtain additional volunteers to help us out. I do hope that more volunteers will come and help us out, not just in dentistry, but just in general, because it is such a rewarding experience. But we always need the additional help. We have an amazing patient base that is in a great deal of need, and additional volunteers will always help out. I can't say more about the executive director, Nancy White, along with the full-time staff and the volunteers that we have here, making my job pretty much as easy as it could possibly be. They always go above and beyond to do an extraordinary job of keeping this clinic running very smoothly and helping out as many people as we can in the very, very limited resources that we have. The people that you're going to meet here are the types of people that will change your life. It'll bring so much more meaning to whatever capacity that you give back to the clinic in, whether it be coming to do what I did first off and answering telephones and greeting patients and filing their charts, to volunteering as a professional, giving back both medical, dental, vision, in any way that you see fit.
To me, volunteer was not a challenge. It was a joy. It was an honor, 1, to be asked, 2, to have the resources to do what they needed, and then 3, to see of all the time that I've put into volunteering here, to see the results, the number of patients that they've seen, the countless of lives that they've saved. People couldn't afford to go here or go there, but they had a place in Macon that they can come for health care, for dental care, for eye care, and for so many other things. Everybody in Macon and Middle Georgia should spend some time giving back. That's basically what it is. If you can give back, the return on investment will blow your head away.